Today we're going to talk about the 5 elements of an attractive smile. You know an attractive smile when you see one, anybody does, but can you articulate what the elements are? There's 5 elements. There's not 50, there's not 100, there's 5. But you need to be able to talk about this to your patients. You need to be able to treatment plan with this information. You need to be able to deliver treatment with knowing this information. If you can get those 5 right, that patient is going to have an attractive smile. I've had a lot of fun with this. I've had a lot of fun making my patients happy with enhancement of their smiles. In some cases, you can have $1 million smile for several $100s. It depends on what the needs are. We're going to discuss those 5 needs and the elements that have to be present for the smile to be attractive. This is an example of a young woman that has a $1 million smile. If you look closely at that, it has the right shade, it has the right symmetry, it has the right size and proportion, it has the right shape, and it has the right smile line. So we're going to discuss all 5 of those. This is an example of one of my patients who didn't like to smile. She didn't smile. She would hide her smile. She'd hide her smile with her cell phone. She'd hide her smile with her hand. She'd hide her smile by pursing her lips. Anything to not be able to display those teeth, everything was absent in terms of the 5 elements. The teeth are not the right shade. There's no symmetry from right to left or from top to bottom. It has the wrong size and proportion. It has the wrong shape. It has the wrong smile line. This tooth is too long. This is too short. So all the elements of that smile that could make it beautiful are absent. After she looked like this, and she reported to me that all sorts of people, strangers, friends, family, were all smiling at her. And I thought about that for a minute, and I said to her, that's probably because you're smiling at them. And she thought about it for a moment and said with almost a tear in her eye, she said, you're right. I'm smiling all the time now. So that was a fun procedure to do, not only for me, but for her. It changed her life. So now we're going to look at some other ones. We're going to identify with the 5 elements what's good and bad about these smiles. Obviously, there's spaces in this area of this patient's teeth. When we correct that and correct the other elements being symmetry, shade, smile line, shape, she suddenly looks very, very nice. Another young woman, 1 or 2 teeth that were off in the smile, in the middle of her face, right in the middle of her face. We corrected that, and she is happy. So a fun thing to do and fun thing to be able to provide for your family and your friends and your patients. You will know it when you see it, but you have to be able to articulate it. And one of the most important elements is shade. So we've got now, things are so light that we had to put a new set of shade guides in this normal shade guide area that includes bleach, because they want their lighter teeth. They want that. We're getting the teeth as light as we can. By lightening, I mean getting them light enough to where they're age appropriate. We can use a very light shade on a young woman or young man. We can't use this shade on somebody who's 75. It just doesn't look appropriate. I like shades on everybody to be appropriate, and I usually measure that by making the shade and selecting the shade and encouraging the patient to select a shade that is about 1 full shade lighter than the white of their eye. Now, that's the white of their eye on a good day. This is a very nice smile, but it needs to be a little bit lighter to really be pretty. So we'll lighten that up, and she's very happy with that. Again, very inexpensive, very fast to do. So again, a beautiful, beautiful smile. $1 million smile for $150, $200, $300. So the next element we're going to talk about is the symmetry. We want to look at the symmetry of the face. We're going to look at the midline of the face. We're going to look at the midline of the lips and the midline of the teeth, the horizontal axis through her eyes and the horizontal axis of where her teeth are. These should be harmonizing intersections. The midline of the lip, the midline of the teeth, the midline of the face. The soft tissue symmetry is also very critical. If we can make this as light as we want, it's not going to look nice. This looks great. In another presentation, we're going to show you how, but here I'm going to show you the significance of it. Now we're talking about size and proportion. The size of the teeth are all going to be different, but the ratios is what you need to be concerned about. The centrals will be about 1.2 to 1.4 times as long as they are wide. The same is true for the laterals. They'll be about 1.2 to 1.4 times as long as they are wide. And same on the cuspids. So that's the symmetry we're looking for and the ratios we're looking for. The next issue on the 5 elements is the shape of the teeth. And the shape of the teeth will be one of 3 shapes and in a combination of those 3. So square, round oval, triangular tapering, or a combination. Combinations work very nice for an awful lot of people, but if the face is very, very round, sometimes a more oval tooth looks more appropriate. That's a patient's choice. That's a very personal thing. The shape of the teeth, this tooth is too long right here, and it's too long over here. It's a little dent here. So with very minimal smoothing right there on the centrals and shaping on the cuspids, we've got a very attractive smile. Again, the symmetry is there, the shade is there, the proportions are all there, the height and the length. These are worn teeth, they look old. These are rounded teeth and long, they look young. So people want their teeth to look as young as possible. We can take those older teeth and we can brighten the shade. The symmetry of the soft tissue is all there, so that's great. We'll just correct the symmetry on the edges of the teeth and the patient's gonna be happy. That's gonna make a huge difference in that smile. The next one is a smile line. This is the 5th and final piece of the puzzle. If the smile line is upside down to the curvature of the lower lip, it's what I call an upside down smile line. This is what looks nice. This is what looks very strange. If you look at that on patients, you'll see that if you follow the overall contour of that lower lip, this tooth is going to be short. This is about the right length, but these are all a little bit too short. So we're going to change that. We're going to change that with a procedure we'll talk about and show you how to do in later presentations. But now the centrals are longer, so are the laterals, and we're following the lower lip as far as the edge or the incisal edge of the upper teeth. Lips are something we really can't do much about. Lips come in all sizes and shapes. I've looked at this a lot. I've given a lot of thought to this. They're all very special. It's as personal as a fingerprint or the iris of your eye. It's very specific. And I think that for the most part, unless there's something that's really disfiguring, lips are best left alone and left as nature provided. I want to talk to you about this patient just for a moment. This patient came to me with a concern about her smile. She was concerned about laughing in a group of her friends because she was so concerned about the appearance of her teeth and her smile. Her face, if you notice, her face is actually quite pretty. She has beautiful eyes and a very symmetrical face, but she's very, very much concerned about her teeth. So in changing and transforming this patient's smile, I think you'll have to admit that we transformed her life. She felt better about herself, had her hair done in a different way. She wears makeup very carefully. She has a little bit of lipsticks on. She's actually trying to call attention to her teeth now. This is what I've noticed, that it changes the patient's personality. They're willing to laugh. And the smile is the beginning of a laugh. And if you laugh, it's healthy. And laughter is good for the soul, and laughter can actually heal. So it's true. And this woman, it changed her life. And it's fun for me to do this. It's exciting for me to do this. It's fulfilling in terms of my practice. And these patients' gratitude is not just paying their bill. This is fun dentistry to do. So take the stress out of doing dentistry and start doing stuff that patients want. Patients desire this kind of result, this kind of treatment. So learn how to make it happen, learn the technology to make it work for you, and I'll help you do that in future presentation. So stay tuned and we'll work through it all.